Welcome everyone to another WIC Works webinar offered with the California WIC Association. This is Margaret Aumann, Communications Coordinator at CWA, and we're here today to learn about steps to reform, changing breastfeeding policies in community clinics. We're glad that almost 200 of you have joined us today from all across the country, and we're going to be excited to share with you about some new resources for community clinics and medical offices in becoming breastfeeding friendly. We've got some great speakers with us today, Linda Cowling from the Department of Public Health here in California, and Robbie Gonzalez-Dow from California Breastfeeding Coalition. I will be your moderator as well as presenting some of the information. So I'll just say right now that that could be a little tricky, so bear with us if we have any technical difficulties. I'll be doing a few introductory slides, and then I'll pass it on to the other speakers, and hopefully we'll answer your questions at the end. So our objectives today are to look at this document for breastfeeding friendly clinics and then list at least 3 steps that community health centers and medical offices can take to becoming breastfeeding friendly, and describe how they will use the document in their communities. This document is in draft form at this time, which you'll hear more about from Linda. And we just want to say at the beginning that we're definitely just giving you an overview or a taste of what the document involves and contains at this time. And we'll let you know how to get more information in the future. Since we only have an hour, that's all we can do. And we're glad that you're here to learn more about what's coming up. Just a couple notes about using GoToWebinar, our platform here. If you're listening on your computer speakers, just be sure it's best idea to close any unused programs that might be streaming data, including email or music or data if you're on, if you're on your computer, and use a high-speed connection if you can, and hopefully the sound quality will be good. We are recording this webinar, and hopefully won't be getting any echo like we have in the past sometimes. If you're listening by telephone, be sure that you've entered your PIN and that you don't have any other wireless devices or anything streaming data next to you, so that because it might interfere, and please don't put any phone lines on hold. There, you can go to support.gotowebinar.com if you're having some technical difficulties. But we've had smooth sailing all summer, pretty much, on these webinars, and we hope you have a good experience with us. We will really look forward to your questions at the end. So type it into the question box and be sure to press send. And the panelists will do their best to answer them at the end of the webinar. And again, we are recording this webinar, and the recording and the presenter slides will be available within a few days after today's webinar on our website. Just a couple notes about continuing education. We have been experimenting this summer with offering CPEUs for registered dietitians. We know that many lactation consultants have been requesting CEUs as well, but at this time we don't have the capacity to offer that for these webinars. If you are a registered dietitian and need a CPEU, you need to have registered in advance. You need to attend the entire webinar. And if you're listening in as a group on one shared computer, you need to send documentation of attendance to our office. And with all that, you will get a certificate in the email. So if you have any questions, just let us know. And if you're new to California WIC Association, we just want you to know that we're a nonprofit member organization representing the local California WIC agency directors and a whole host of supporters outside of WIC who are supporting the Special Supplemental Nutrition Program for women, infants, and children. Our main efforts go toward training and staff development, public education and advocacy, and research and policy analysis. We welcome new members at any time, so check us out on the web at calwic.org. With that, I'm going to pass it on to Linda Cowling at the California Department of Public Health. But I also want to mention we have with us today Karen Farley, Program Manager at CWA. And Karen, I didn't know if you wanted to say some words of introduction for Linda while we switch over to her slides.
No, just thanks everybody for coming on the webinar, and California WIC Association and California Breastfeeding Coalition had the opportunity to work with the California Department of Public Health, and Linda has some great information to share with us, and then Robbie and Margaret will provide more details.
Great, thanks Karen. Linda, you're on. I think we see your slides, and we look forward to hearing from you.
Okay, great. Thank you, Margaret, and good morning, everyone, and thank you so much for participating in this webinar with us. I am thrilled to be a part of this, and over the course of this hour to kind of explain some steps that were developed to help you all become a breastfeeding-friendly community clinic. But before we go through the steps, I want to kind of give you a background as to how these steps were developed. And they were developed in a project that we in California refer to as the California Breastfeeding Support and Community Clinics, which was a joint venture between the California Department of Public Health, the California WIC Association, and the California Breastfeeding Coalition. If I can make sure I can do this right here. Ooh. Okay. In California over the past 20 years, there has been a tremendous amount of momentum surrounding breastfeeding. There has been legislation that said, you know, breastfeeding is a good thing and it's something that women should be able to do. There has been more information and importance placed in work sites, accommodation. The public has been made aware of breastfeeding and the importance of breastfeeding. We have in California 58 breastfeeding-friendly hospitals, and we have 84 local WIC agencies. And what we have found over the years is that momentum has primarily been in hospitals and in the WIC clinics. But what we found is that there was a bit of a gap in the community clinics. And in California, there are over 800 community clinics which serve 4.7 million low-income patients. So we saw that this was an area that we could work on. And also nationally, there was some recognition that said there needs to be more focus and emphasis placed on postpartum breastfeeding support, which was perfect for us because in 2012, the CDC released a funding opportunity announcement which was aimed at increasing breastfeeding duration rates in communities of color. And the CDC allowed each state to decide how they wanted to focus their project, but we focused on community clinics. Again, there was a gap in the breastfeeding support, breastfeeding policies, so we said, well, let's work with some with community clinics to see if we can do something in that particular area. Now, these community clinics are doing some tremendous work. They are hardworking individuals, but they just needed a little bit of help with in terms of developing policies and guidelines and criteria on how to become a breastfeeding-friendly community clinic. So the goal of the project was to provide community clinics with professional breastfeeding support to help mothers prenatally and after they return home from the hospital, to help them be able to breastfeed as long as they wanted to or until the baby weaned. The second goal was to develop draft steps, guidance, and criteria which would define a clinic as breastfeeding friendly. So this here is a picture of individuals from our community clinics. We use an RFA process and we selected 15 community clinics. We received about 70 different applications and we selected 15. And all of these community clinics served a large number of low-income women and women of color. And all of the community clinics that we selected had, with the exception of one, multiple clinics within their organization. Only one of the clinics had one clinic, but of the other 14, there were multiple clinics within their organizations. And we chose to work with them because they were centrally located throughout the state and, again, serve women, low-income women of color. So this is a picture of us on our kickoff meeting. This is members of the community clinics, members of the CDC, those of us from the Department of Public Health, from the WIC Association, and the California Breastfeeding Coalition. Just to kind of give you an idea, this might be a little bit hard for you to see, but kind of give you an idea of where the clinics were located throughout the state. So we looked at various data to kind of give us an idea of where there were low numbers of breastfeeding initiation and duration rates. So we chose to focus around the Bay Area, Sonoma, Sacramento. We went through the coast, Santa Cruz, Monterey. We went in the Central Valley. We went through Los Angeles and in San Diego. So of the 15 community clinics, they were located in 11 different counties throughout California. So during this one-year grant, where we gave community clinics $25,500, we asked a lot of them. And there were three major projects that they had to work on, and three major objectives. The first was to participate in a collaborative improvement and innovative network, or a COIN. And they met on a monthly basis, where either over a webinar or conference call. There was a private web page with resources that was developed during the course of this 1 year. They had their own listserv, and they also communicated by email. And the second thing they had to do, and this is really big, they had to implement systems to provide and bill for professional breastfeeding support services and pumps. We wanted to make sure that they had some systems in place so once this grant was completed that they can generate income to support the breastfeeding services and projects that they had developed at their clinics. The third thing is while they were implementing the activities of the grant, we wanted them to use their experience to help us develop and pilot draft steps, guidelines, and criteria that you're going to be hearing about in a few minutes. And this was the biggest part of this project because we had 15 clinics, but we really wanted to make sure we had something in place that we could develop and send out to other community clinics. So in addition to the three main objectives, we also asked them to collect data on breastfeeding rates and billing claims that was going on during the year within their community clinics. And we also asked them to commit to worksite lactation accommodation laws for the employees. And I will tell you, we were just so thrilled with the 15 community clinics that we selected. You never know who you're going to get, but we were just thrilled with how well they did. All of the community clinics worked on improving staff skills and providing lactation support. So the main focus for them was on staff training. All the clinics included IBCLCs for patient care. They all improved their staff skills to bill Medi-Cal for lactation and breast pumps. And they all developed policies and procedures to ensure that there was some sort of sustainability once the grant ended. They also identified ways on collecting data. Since we asked them for data, some of the clinics had to come up with ways of really collecting the data that we asked of them. They all provided worksite lactation accommodation at their clinics. Every one of the clinics formed a breastfeeding task force, and they all did an inventory to determine where there were gaps in breastfeeding support at their clinics and made a proper adjustment to take care of those gaps. In addition to all the different activities that and the objectives that I just mentioned, they also worked with an expert advisory board, and this was the group that helped us develop these steps and guidelines for the breastfeeding-friendly healthcare provider. This expert advisory board was made up of 16 individuals who were physicians and WIC directors and nutrition experts and breastfeeding experts, and they helped us review materials, existing materials, that we could use for our guidelines and our steps. They reviewed draft steps, criteria, and guidelines, and they worked with the COIN clinics. It was amazing how, regardless of how busy the expert advisory board members were, they met twice a month on calls. They also spoke with each other via email during the month. So it was a tremendous amount of work that the clinics were able to accomplish, as well as the expert advisory board members. So what I'm going to do is I want you to hear about the steps. And what we currently have are draft steps, and they are currently being reviewed throughout the department. But we at the Department of Public Health are committed to finalizing these and sending these out, so everyone, all the doctor's office, all community clinics will have some sort of steps and guidelines and criteria that will allow you to also become a breastfeeding friendly clinic or doctor's office. So before I hand this over to Margaret, I want to show you the people that we actually worked with during this project, and we couldn't have done it without them. So this is me, and you're going to hear from Robbie, and she's from the California Breastfeeding Coalition. We had Karen Farley from the California WIC Association, and one of my colleagues here within the Department of Public Health, Suzanne Haydu from the Maternal Child and Adolescent Health Division. So that was just a very brief background as to the project and what we did during that 1 year. But I'm going to now hand this over to Margaret so you can hear really about each of the different steps that were developed. Margaret?
Fabulous, Linda. Thank you. I'm switching over.
Margaret, you're going to have to control
and that's
the
Robbie.
slide.
What's that?
You're going to have to control the slide.
Okay. Let me get them up and going here.
So this is Robbie Gonzalez Down. I will start first, and as Linda explained, to give you some background information about the Expert Advisory Board. And I just want to say that they were such a dedicated group of people. We started recruiting in late 2012, and we recruited 16, you can go to the next slide, 16 members, and as she said, there are physicians, nurses, dietitians, lactation consultants, and they came from community clinics, county health systems, health departments, WIC, and breastfeeding coalitions. Next slide, please. And they met twice a month. They had many meetings from February through November, so they met a lot. And what we looked at were many existing documents related to creating a breastfeeding-friendly office. And the first one included the American Academy of Pediatrics, their breastfeeding initiative on how to have a breastfeeding-friendly practice. They also looked at the Academy of Breastfeeding Medicine protocol on a breastfeeding-friendly physician's office. They also looked at the American Congress of Obstetricians and Gynecologists clinical review, the special report on breastfeeding, maternal and infant aspects. The next one, please. And they also looked at the UK Breastfeeding Community Initiative. And we have a local example, the Riverside County Department of Public Health, their Loving Support Breastfeeding Friendly Office Program. And lastly, the Baby Friendly Hospital Initiative Guidelines and Evaluation Criteria. It was really important that the guidelines and criteria that we were developing for community clinics and outpatient care settings were consistent with the Baby Friendly Hospital Initiative, so that we would have consistent messaging, especially with steps 3 and 10 of the Baby Friendly Hospital Initiative. So as Linda mentioned, that the 15 clinics did work with this advisory board, and they came together for a joint meeting on April 30th. And the advisory board had already had a drafted preliminary set of steps. And so this joint meeting, they looked at every aspect of the drafted steps. Next slide, please. So they reviewed every proposed step in detail. Next, please. And they discussed how and why the steps, what was it appropriate for a breastfeeding-friendly clinic. They made suggestions on how to improve the proposed steps and on guidelines that could be included under each step. And overall, it was a very productive day with a diverse group of people who care about improving lactation services along the continuum of care. And through about a year's work, they developed the breastfeeding-friendly guidelines and evaluation criteria for community health centers and outpatient care settings. And there are 9 steps. Didn't quite make it to 10, but there are 9. And so the first one is policies and protocols to establish and routinely communicate to all clinic staff a written infant feeding policy that promotes, supports, and protects breastfeeding in human milk as the normative standards for infant feeding and nutrition. And this is a really important step to improve practices and to sustain change. And you'll see with just about every one of the steps it does mention creating protocols related to the policy. Next, please. And in this, and you'll see with every step there's a consistency, so it will tell the step, and then there's going to be guidelines. And then after the guidelines, there's going to be evaluation criteria. So for the policy and protocol guidelines, there are 4 guidelines, and the first one is to develop a written infant feeding policy that addresses breastfeeding in human milk as the normative, just what it said in the step, but also adheres to the International Code of Marketing of Breast Milk Substitutes. And then in each step, just about, it's always how are you going to communicate that policy or protocol. So in here it talks about you have to communicate this to all your employees and your new employees. Display the policy, have just a summary of it displayed in a prominent area, and also to create and implement evidence-based protocols that apply to all the rest of the steps. And then there's a criteria for evaluation, and they're very consistent, again, with the guidelines. So for the evaluation, we'd want to see a written infant feeding policy. Does one exist? Can the clinic management and the staff tell you or tell someone where the policy is located? Can they describe that they actually received an orientation on it and training? Is the summary of the infant feeding policy prominently displayed just by visually looking around? And can you see a written clinical protocols that support implementation of steps 2 through 9? And then the second step, Margaret will describe.
All right, thanks, Robbie. That gets us off to a good start, and you'll see a lot of similarities with all these steps. So in some instances, I'll just summarize. But yes, the advisory group really did try to parallel the same requirements that are for breastfeeding-friendly hospitals, baby-friendly hospitals. So, and you'll see the same pattern where you have a step and guidelines and then criteria for evaluating whether that guideline has been met. So step 2, as you can imagine, follows directly from step 1, the policy. Once you have a policy, you need to have staff who are empowered and enabled to carry out the policy and protocols. So the key here is that it's competency-based education and training for all clinic staff at all levels. And so the skills will correspond with the expected service provided by each staff person at their level. This photo shows an example of Salud para la Gente, which is a clinic in Watsonville, California. They had collaborated with Community Bridge's WIC program to get some breastfeeding education staff training for their community health workers, and using the breastfeeding peer counseling program that comes from the WIC program. So it's a lot of great collaboration. I believe this was a 16-hour course, and I'll give another example of other kinds of training. But so the guidelines under staff education and training are, first of all, assessing the needs and developing a training plan. Anybody who's done staff training and education knows that this follows a pretty prescription that works in making sure that education is effective. And then again, the key here is competency-based education and training. And then you just evaluate whether they are competent based on their skills for providing breastfeeding support. And then you may have breastfeeding experts such as an IBCLC or a physician who's trained in lactation support on your staff, but you may not, and so a clinic might need to have a contract, and we'll talk about that later with a lactation expert. And then how do you know if the clinic or medical office is meeting the guidelines? Well, there's written training plans in place. There's a staff training timeline. There are training records showing what skills were taught and evaluated. And then there's documentation showing that a breastfeeding expert was on hand and available. This is an example of another clinic that did 2.5 hours training for physicians. It was done remotely, hence you can see the screen there. Using the technology is really important when that's available. And another thing to note is that, 2 hours here, 16 hours there, whatever, the training can be done in small increments. Some places are doing it in 30-minute staff meetings. And again, many WIC agencies have offered to provide training since they have a lot of training already in breastfeeding support. So there's many ways to provide staff education for step 2. Step 3 is patient education. Now that your staff are trained, they go and provide the support that starts early on in the prenatal period and goes throughout the postpartum period, including pediatric patients, and emphasizing that breastfeeding and human milk is the normative standard, as we've talked about. So again, the guidelines here are providing accurate and evidence-based education and information at any stage, but the 2 stages basically are A, prenatal, and B, postpartum and pediatric patients, and encouraging breastfeeding and the use of human milk at all times. So how do you know if patient education is being provided according to the guidelines? Well, there's written education materials in place. There's verbal confirmation from randomly selected patients. So patients are interviewed by the people evaluating. That's the proposal anyway, and they can report that yes, they received this type of education. And of course, the bottom line is it's in their medical record. Then we move on to step 4. So patients are educated. Well, they need to be supported all along the way. So but the point here is that they're getting the type of support that's one-on-one, as you'll see in this photo here and some others. And it's tailored to the mother-baby dyad and supports breastfeeding all along the way. From prenatally, one of the guidelines is to make sure there's a prenatal breastfeeding history and breast exam, and then appropriate counseling so that the mother is prepared when the infant is delivered. And then soon after hospital discharge, an infant feeding assessment is made. There's follow-up and referral throughout all postpartum and pediatric care until the child is weaned. And there's a triage system in place. Clinical services, of course, is the bulk of breastfeeding support at a community health center or medical care facility. So the guidelines continue with providing lactation expertise, making sure there's time and space so that people can meet and provide for the needs of the patient. That the appropriate and current growth charts for the various ages and for breastfed babies are used. And also to promote participation in breastfeeding support groups. So this is just one example of the type of one-on-one, personal, positive, hands-on support that we're trying to promote among all service providers on the continuum of care. And of course, the criteria for evaluation are similar to other steps and guidelines. There's medical record documentation. Patients report that they've received the support and education they need. And the services, the lactation staff have the skills they need. There are triage protocols, and there's either a contract or a referral agreement with an IBCLC or somebody on staff. So now Robbie's going to talk more about step 5, clinic environment.
Thank you, Margaret. So step 5 is clinic environment, and we're asking to establish, provide, and maintain a breastfeeding-friendly clinic environment. And I'll go into some detail about what that means. But this is a picture of Community Regional Medical Center, the Children's Health Center in Fresno. And you'll see that BFF on the right. It's actually a community initiative with the first 5 there in Fresno, where they're promoting breastfeeding-friendly places. Not just clinics, but also workplaces and in the community. So with the first, there's 2 guidelines with the clinic environment. And the first, again, consistent with the other steps, is to have written procedures and a quality assurance plan that ensures a breastfeeding-friendly clinic environment. And we did define what that means, which I'll go into more detail. And again, communicate the breastfeeding-friendly quality assurance plan to your staff so that they're knowledgeable of what that means, where the plan is, and who's responsible for carrying it out and ensuring that this happens. So the first is, you'll see this, we all know formula is distributed. It's sent unsolicited to clinics. And so we're saying clearly define storage location for formula supplies, keeping them out of view of patients and their families. On the committee, it was important that they said that the physicians there, that physicians do need to have some supply of formula. They don't need this much formula, so you really need to clearly define how you're going to handle formula when it does come in, and who's responsible for that. Obviously, they don't need that much. The next part of what it means to be a breastfeeding-friendly clinic for the environment is to distribute formula supplies in a private exam room following privacy procedures and appropriate for the administration of medication and other treatments. So the same procedures they have for other medicines, treatments that are medically necessary, this is how they would provide the formula supplies also. The next is neither accept nor distribute free gifts and materials such as writing pads, gift pads, storage bags, diaper bags, pens, calendars, etc., or personal samples from companies manufacturing infant formula. And this really is consistent with the WHO code. The committee felt it was important to list everything in this guideline, and also that this is communicated, that staff are trained to recognize and avoid formula marketing because somebody just might walk in the door, and to learn how to refuse the free gifts and the gift packs. And the next is to use and display non-commercial evidence-based materials that promote breastfeeding in the clinic and waiting areas, such as posters, pamphlets, educational materials, signs welcoming breastfeeding, pictures and photographs of breastfeeding mothers, and include materials specifically for populations with low breastfeeding rates served in the clinic. And this is just an example, again, at Salud para la Gente. This was a free poster from USDA from one of their campaigns for Latina moms, and they framed it and put it in the waiting room. And also, there's also the part of communicating, including who's going to review the appropriate materials. Are they inappropriate? Are they appropriate? Who does ordering and copying? Distribution of breastfeeding-friendly handouts and materials in the waiting rooms and exam rooms, and having examples of what's appropriate and not, so training the staff. And the next is to prohibit use of any printed material and visual materials that market breast milk substitutes, bottles, nipples, pacifiers, and other formula supplies or coupons for any of the above items. So again, consistent with the WHO code, and again, communicating to the staff, training and designating clinic staff to preview and evaluate education materials, because they are sent to the clinics for free and they look nice and glossy. So it's very tempting to use these products, but they do advertise formula and the other products. The next is to set up a clinic design that's friendly, that the furniture is comfortable and supportive of a breastfeeding environment. And the other part is that moms are not, they're allowed to breastfeed uninterrupted if they're in a waiting room or another room. This is also another picture in Fresno at the the Children's Health Clinic. And they have this room for support groups and for moms who don't feel comfortable breastfeeding in the waiting room, although they try to make it as comfortable as possible for them to breastfeed in the waiting room. But this is another place that they can come and sit, and they can also do some consults in here. But it doesn't interrupt clinic flow. So those are some of the issues that clinics need to think about if they have what they call rooming policies, when that room needs to be needed and how often it needs to turn over. So this is a nice alternative. And of course, there's criteria evaluation for this step. There's quite a few that are very consistent with the steps, again, having a written quality assurance plan. And did they do a self-assessment, an observation, scanning their clinic based on those guidelines? And again, there would be some randomly, they would choose moms and ask them, did you feel supported? Were you allowed to breastfeed in here uninterrupted? So some auditing and surveying. Also the management description of how breastfeeding friendly quality assurance plan and their role. So they would have to be able to describe how they create a breastfeeding friendly environment through their quality assurance plan, and then whose role is it and how did they communicate this to the staff. And there would be documentation about that. Staff would also be randomly selected to find out to confirm, did they receive training? Can they identify the designated person for the different jobs so that it just doesn't fall on one person's, it's just not their job, but there's a shared responsibility within the clinic, and that there will also be records that would confirm the training and the communication. So step 6 is community resources. And this is collaborate with local agencies and health professionals to ensure continuity of care and breastfeeding support in the community. And it doesn't have to be difficult. For instance, this is an example of what Tulare County has drafted. This is their resource guide, and it is put together through a community process where hospitals and clinics and WIC programs and lactation consultants in the coalition is involved. So with the guidelines for community resources, there are 2. And the first is to identify and collaborate with local agencies and professionals to improve breastfeeding supports. And what that means is designate an employee. Maybe they attend meetings. It's really difficult sometimes for clinics to pull out a person from the workflow and to have attend a meeting. But it is important to collaborate with your community partners. Establish agreements with them. Maybe you don't have a lactation consultant on staff, but you have a really good referral system. Communicate with your local agencies, professionals and birthing centers regarding the breastfeeding education counseling that you provide. Have consistent messaging. And also collaborate with the payers of breastfeeding benefits. In California, when it comes to community clinics, there's Medi-Cal. In the rest of the country, it's Medicaid, and insurance plans that you accept, and collaborate with them to ensure that breastfeeding benefits are paid and to avoid miscommunication. And the other guideline is communicate, the established collaboration agreements and communication protocols to staff, so that staff are aware the processes and the protocols that you have set up for creating your list and your referrals and who you're collaborating with. For the criteria, you'd have a list of the local agencies would you use for referrals and documentation of the communication of the protocols and collaboration agreements with local agencies and the training with your staff. Other evaluation criteria, again, that staff would be able to locate where the list is. Do they have access to it? Do they know where to find the protocols and collaboration agreements with the other agencies? There could be an audit of medical records showing that mothers that breastfeeding mothers were appropriately referred, and that mothers who are having problems that they received services. So the 7th step is workplace accommodation. And we decided not to put this under clinic environment because we felt this is a human resource issue and we didn't want it to get buried under that step. So it has its own, and it's provide and maintain effective lactation accommodation for all employees within the organization. And this is just an example at Salud para la Gente that the ultrasound room is used on Mondays, Thursdays, and Fridays for moms, employees who need to pump. And then it's another room on other days, but it's very clear on the front of the door. So with lactation accommodation, the first thing again is to develop an organizational policy. And in that policy, we would want it to start with an affirmative statement that demonstrates support for breastfeeding women in the workplace, specify how managers and supervisors will be trained to ensure implementation of the policy. Again, communication, it's very important. Communicating the policies that describe employees' rights prior to and returning from maternity leave. And how do they request lactation accommodation? Explain how lactation break times are scheduled and how additional lactation time would be accommodated if she needs more than her 10 or 15-minute break. Define the space options and designated locations for lactation that are private and free from intrusion. Explain the process to acquire breastfeeding equipment. Does a company provide it? Is there one on site? Or is it reimbursed through her insurance? And then how to store her milk safely. Describe how pregnant and postpartum employees will be offered breastfeeding education and access to lactation consultants. And then including an atmosphere of tolerance. Ensure that breastfeeding does not constitute a source of discrimination or harassment in her employment or even access to employment. The other 2 guidelines under lactation accommodation, the first is to train all the employees. So that's very consistent with the entire 9 steps is training employees on the policies and procedures, and to conduct an annual review of the lactation accommodation policy. Make sure it's up to date. Did anything change? Maybe you have your location specified and you had to change a location or a procedure changed, but just to have an annual review to make sure that it's up to date. For the evaluation, we'd want to see the policy and that it describes all the elements or recommended elements to have in your policy. And training records. Were staff trained upon hire, and was there periodic update on the training on the lactation accommodation policy? And that could be as easy as sending out an email. So just ensuring that that employees are still aware of the policy. And was it reviewed? Documentation that it was reviewed. So this is a picture of the site in Fresno at the clinic there. Because they have so many employees, they do have a designated area. They call it a mother's room, and this is for their employees to pump. And you can see they do provide a pump there, so a mom doesn't have to bring her own. Sonoma County Indian Health Project, they refurbished, so they had a bathroom that they didn't need, and they removed the toilet, which then it became a perfect area for lactation accommodation because the sink is still there. And then on the next photo, they added a refrigerator. There's a chair. And on the next, you can see that they also have a pump there for their employees to use, and put another chair under there. But it's also a multi-use room, so if somebody needed to use it for other uses, they could.
Great, Robbie. Those are some fabulous examples of how it's actually happening in clinics. And I just wanted to say that throughout all of this, I mean, this document so far has been designed to be extremely thorough, as you've probably gotten that picture of it. But that clinics will have different approaches to how they implement guidelines like this. Sometimes it'll depend on who they serve. Some clinics will serve pregnant and postpartum and pediatric populations, but sometimes they'll only have 1 or 2 of those. And they'll still need to be breastfeeding friendly. but they'll be able to adapt it to their own situation or their parent organization structure. So there's, flexibility in terms of what applies to different clinics or community health centers. Step 8 is coming right up if I can get it. There we go. Financial sustainability. Now this, if you're not working in a community clinic, you might wonder, why is this a separate step? But it's so important that, for example, IBCLCs are used as lactation experts, but how do you make that work? Well, it turns out that clinics are very good at developing business plans. Most of them run as a business, and that many of them are finding that using lactation consultants is a sustainable practice in their business model because they have done their homework and made sure that they have a financial plan in place that provides the services they need. So for this guideline, the first off, they need to develop a financial plan. There's lots of things that can be included, and there's some suggestions in the guideline, but most of them know what needs to be included, including billing codes and expected and actual reimbursement rates, how they're going to get it reimbursed and how soon they're going to get reimbursed, and things like that. And secondly, they the guideline is that they will use clinical care and billing tools to implement their financial plan, including using the electronic medical records to the best of their ability. So here's just one example of how, in this case, a federally qualified health care center has been determining potential revenue. They look at their reimbursement rates for different types of appointments, number of visits, etc., and they plan out how they're going to get reimbursed for lactation services so that they can provide them in a sustainable manner. So how do you know whether they're following these guidelines? Obviously, a financial plan is in place, and it coordinates with the agency's financial analysis. So again, they can adapt it to how they do business already. And there are invoices that show the billable services and accurate coding, and then a description of how their services meet the community needs, so that they're showing a need for the service and then how they're meeting the service, meeting the need. And step 9, lastly, is the quality improvement and impact evaluation. And of course, this is what many of us are looking at in the end, is what kind of impact is all this breastfeeding services, are these breastfeeding services having on child health and breastfeeding rates and that kind of thing. So clinics under these guidelines are required to establish systems of data tracking and looking at quality assurance and quality of care measures. So the guidelines include looking at continuous quality improvements systems and developing a system to monitor breastfeeding data, and then share that data with local agencies and compare them to state and local rates to see how they're doing and how they could improve. Here's one example from Altamed Lactation Clinic at Children's Hospital in Los Angeles, where they are starting to implement more breastfeeding-friendly practices, but at different clinics they're doing different levels of support. So they're able to compare the breastfeeding rates, and the green line, in case you can't tell, is a lactation clinic where they are given the maximum level of breastfeeding support, patients are, and what do you know, breastfeeding rates are the highest there. So that's the kind of impact evaluation we love to see. So if a clinic is following these guidelines, you'll be able to see by their quality improvement reports, you'll be able to look at infant feeding outcomes, a description of how breastfeeding data is shared. It will be available, and you'll be able to see the impact and how they can improve. So that is a pretty quick overview of a very detailed document that a lot of people had a hand in making it high quality, and we are open to taking your questions at this time. So please, I know you've been typing them into the question box, and we'll take a look now. But I just wanted to say if your questions don't get answered, feel free to contact Linda, Robbie, or Karen Farley with any questions you have about this. So I will open up the questions and see what's happening. We don't have a lot yet, but if there's something else you've thought of, Linda or Robbie, that you wanted to say while we wait for people's questions to come in, please speak up.
I don't have anything at this time. You know, as we've been reviewing the document, so much is doable. It's doable. So I think that's the one thing I wanted to say, is that this really is doable and it's important, and there's great outcomes when we support moms with lactation services when they need them.
That's a great point. And clinics are showing us how they're able to do it. And it'll be a process to get that information out to other people who want to replicate what they're doing.
And I just want to say that this was such a tremendous effort by a large number of people who worked on this, who reviewed, and are continuing to review. So the community clinics that were awarded funds, as well as the expert advisory committee members, have received a draft copy of the steps. So as I mentioned earlier, we at the Department of Public Health are committed to finalizing the document and sending it out. But I think if any of you work for government agencies, you know that if your government agency logo is on the document, it takes a while for documents to be reviewed and approved. So, but just as soon as it is approved, we will be sending it out. So we just think that this is something that all community clinics and doctors' offices would really benefit in having. And what we saw with our 15 community clinics is they were able to implement a lot of these steps in a short period of time. So as Robbie said, it is definitely doable.
Great. So a bunch of questions are just flowing in. So we'll do this as efficiently as possible, and some of them will go quite quickly because they may have already been answered, but the person asking the question may not have heard the answer. So do we have a time frame for when this document will be released, Linda?
We do not. There is going to be a letter that the Director of Public Health intends to sign. So it has to go all the way up.
Right.
So I'm not really sure, to be perfectly honest with you.
That's fine. And what are the plans for assessing clinics for the evaluation criteria?
Yeah, so when we had this grant, that was really the first step. The first step was to develop the guidelines. What we would like to do next is develop a toolkit that will go along with the guidelines. So part of that will be determining how we're going to evaluate how all this is working out. So more to come on that.
Okay, great. And that answers this other question about, is there a resource for helping a clinic fund an IBCLC through insurance billing and Medi-Cal? That's the kind of thing that would be included in the toolkit, right?
That is correct.
Yeah. And then somebody has a question, are IBCLCs reimbursable by Medi-Cal, and is licensure required? Robbie, do you want to take that one? Or maybe, yeah.
Is Karen right there? I think Karen would be the best.
Yes, IBCLCs are reimbursable if they're unlicensed, working under a licensed provider.
So that's the quick answer. Let's see, a few other questions here.
Can you say that again, Karen? So
IBCLCs,
reimbursable under...
yes, IBCLCs can bill for lactation, but they need to be working under a licensed provider.
So that's the key.
Right.
In California, we do have a special program. We know there are a lot of people on this call nationally, but in California we have a Special Medi-Cal Enhanced Program, the Comprehensive Perinatal Services Program. We won't go into all those details, but there's a lot of opportunities for lactation experts to work in a CPSP program. But folks who have enhanced Medicaid programs in their state should look that up for their own state.
Okay, I'm going through the questions, and a lot of them have been answered by the last few answers. Let's see. So somebody asked what was the funding source for this project. It was the CDC. That was mentioned earlier in the webinar, and the PowerPoint presentations for this webinar and the recording will be available on our website in a couple days. So if you have any questions about that, there's your answer. Here's an interesting one, but I'm not sure we can answer it, but it's an idea that we'll put out there. Is, do any of the clinics do classes for their breastfeeding clients who are going back to work? Do you know of any, Robbie?
No, not specifically. That, you know, if they're participating in the clinic's Comprehensive Perinatal Services Program, CPSP, then the health worker may do some individual counseling with them to help them as they go back to work and transition back to work. Because moms do go back to work fairly early, or they may provide some of that counseling prenatally because they do an assessment to identify issues that they may have. But I don't think a class.
Okay.
I do know of some WIC programs that do classes for going back to work. Specifically, Monterey County does one.
Okay. Thank you. This isn't a question, but it's really valuable information supplied by Heather Reedhead, who was a physician on our advisory group, very instrumental in helping with this document. She makes a good point that there's a very valuable role for local county breastfeeding coalitions and health plans to help clinics understand the local billing environment and local durable medical equipment suppliers and other support resources like WIC. So really, you know, just remember you have a lot of partners on your local level, whether it's breastfeeding coalitions or health plans or the WIC program, who can help you with a lot of the questions that people might have in getting something like this going. Thank you, Heather.
It may take, that's where the communication is so key.
Yes.
And to keep communicating and collaborating with your partners, you know, not just one time, but many times. The clinics did meet quite often, and they had task force within their own sites, the 15 clinics that were funded, and it takes many meetings sometimes to implement one of the steps. Not that it's, you know, it can't happen, but the communication is key.
Yeah, and meeting with those partners will really identify the gaps. And part of the success of community clinics, breastfeeding support, will lie with health plan providing quality breastfeeding support. And that's part of the challenges of the rollout of the Affordable Care Act. And another comment on this list of questions is that areas are having trouble getting durable medical equipment. So we've been dependent on WIC for a long time, and now we're asking our community clinics to step up, but they also need the support of their health plan. So it really is building quality support in all those partners in the continuum of care.
All right, well, it's time for us to wrap up. We've really appreciated your questions. We're not going to get to quite all of them, but you have the information here on this last slide for the contact information, and we'll also forward your questions onto the presenters in case there's anything they can help with. We really appreciate Linda Cowling and Robbie Gonzalez-Dow being with us here at CWA today to present about this exciting resource coming up. There's some great, well, I just want to mention again that this recording will be available on our website at calwic.org under the Events tab, and that we have a couple webinars coming up. The next one in middle of August, you can find out more on our website, is with some of the community clinics who've been involved in this project. So you'll hear more of the nuts and bolts of what they did. So we're excited about that. And then another on hospital breastfeeding rates, the most recent data released for California, and that's later in August as well. So we hope you'll join us for our next free webinar. Thanks so much, Linda and Robbie.
Thank you.
Bye-bye.